Well, good morning, everyone. Can all hear me this morning? Thumbs up if I'm coming in loud and clear. Thank you very much. Okay, just as a housekeeping issue, please at this time turn off your microphone for us.
I call readjust.
Jeffrey, that sounds like you. Thank you, sir. We appreciate your passion and dedication to your work this morning. Again, good morning, all. I hope everyone's having a wonderful Wednesday morning, and we're excited to have the entire task force team back together this morning. I do want to take just a few minutes to just once again thank everyone on behalf of our superintendent, Ms. Bird, Polk County Public Schools. I want to thank each of you individually. I want to thank each of you collectively as a team for the tremendous effort that you've given this task force and the expertise that you brought to the table. Your perspective and vantage point has been absolutely amazing and remarkable, but also essential to giving us the opportunity to create and develop a comprehensive plan to do our very best to provide an excellent educational opportunity for every child. And so your effort, your time, your energy has made a difference for us. It's made a difference for our children, for their families, and for our community. And so if you take a look at that screen there, you'll see that we've put in some time and we put in some work, and you've given of your time and expertise. So again, thank you very much for that. In regards to the challenges that we face, we know and we've found through our discussions and deliberations, and working to create a plan that will attend to all the various situations that could and will potentially arise due to the pandemic. We have found that it's a very complex situation, very challenging situation. And yet we've come up with ideas and ways to do or to provide mitigation and to move forward and to create a plan that we can implement. And so very thankful for that and appreciate that very much. As I mentioned in the email yesterday, for those of you that had an opportunity to see it and read it, we appreciate very much our public relations department working closely with us to keep our community up to date and to be transparent with the process with them. And we know that there's been a lot of angst, there's a lot of questions, and we're certainly working diligently to be able to answer those questions and provide some some information that hopefully will ease those concerns and provide a plan that will ease those concerns and help our parents determine the best educational selection for their children. And so, again, your work in regards to that has been tremendous. Also, want you to continue to be aware that after today, we're going to take this information and continue to develop that plan. We will be presenting that plan, an overview of that plan, to the school board members on Tuesday, July 14th. That work session will be at 11 a.m. And so we're looking forward to that opportunity. And as you know, we've been working on FAQs, each team. I do want to take an opportunity to thank the health and safety operational team, the health and safety whole child support team, the team that's working on the instructional side of the equation. And we've also had some other groups. Steve Cochran has led a team working with how do we organize and continually utilize our volunteers during this pandemic. So I know there's been others that have reached out and worked with focus groups and our community leaders to help infuse our teams and help bring information to the table to enable us to make excellent decisions about how to move forward. And so thank you again. We appreciate it. With that being said, at this time, I hand it off to Ms. Porteous. And Ms. Porteous has got a special guest that she'd like to introduce to us.
Good morning, everyone. I'm Tedra Porteous, the Associate Superintendent of HR. At this time, I'd like to introduce two special people that we thought would be very important to have us hear from. One is Dr. Ken Alexander. He's the Chief of Infectious Disease at Nemours in Orlando. And I also have Dr. Kadia, and she is an infectious disease team member at Nemours Children's Hospital in Orlando. Are they both on? Maybe?
Okay, it's Adriana Kadia. Can you hear me?
Yes. Hi, Dr.
Hi, guys. I have not been very good at this whole technology thing. The muting and unmuting gets me every time. I believe Dr. Alexander is still trying to log in.
Okay.
Dr. Alexander, did you get to join us yet? I don't think so. Okay. So I'll start out by saying thank you so much for allowing us to participate and inviting us. We understand that this has been a very new thing for everyone, not just us. And initially, yes, it was the healthcare systems that we were trying to figure out what it was that we were going to do to keep our people safe and effective and working. And now we understand that the concerns that the school systems are having are exponential. And so I believe that you guys have done a great job so far, and we are more than happy to help you as far as any extra medical suggestions or questions that you have, because I know that there are a lot of those.
Well, thank you. I think overall, one of the main questions we are hearing, I'm not sure if you are aware, but the governor has essentially said that we will open schools 5 days a week, and we are required to have a face-to-face interaction. And so the main question that we have, particularly in the era that we're living in now, in terms of COVID, is what can we do as a school system to make sure that our staff members are safe as well as our students are safe when they return? How exactly does COVID spread, and what can we do to limit the spread of the disease to make sure that we protect both our staff and our students?
Okay, I'm sorry, I lost you there for a second. I think I heard the entire question up to the end of what we can do to limit the spread. Was there anything else after that?
No, that was it.
Okay. Unfortunately, as you know, there is a lot of questions still out there as far as exactly how the virus spreads. We firmly believe that this is mostly spread by droplet. There are some procedures that can make it aerosolized. And then the difference between droplet. So this is when you think of when you're talking, spitting, coughing, that these large, the virus will be on these large droplets that generally fall to the floor within 3 to 6 feet. And that's why social distancing has been so important, so that if you're over 6 feet away, the majority of these droplets will have fallen to the ground. Now, the aerosolizing portion means that this virus would be around longer. And we don't think that this is a main method of transmission. There is a lot of data to support that. There are some instances where we do certain procedures which would aerosolize the virus. Be happening. Ooh, I have a lot of background noise. Can you hear me?
Not very well.
Okay, is that better?
That's much better. Yes.
Okay. Yes, something happened there. And so these aerosolizing procedures should not be generally occurring in the school settings. I do know that a lot of children receive nebulized treatments. The jury is still out on that, and so what we've been recommending mostly has been to stop nebulizing treatments if you don't really absolutely need them, and then just move to MDIs, because we understand that some students are going to sign up. And then the other thing that we know that is effective is wearing the mask, which now a lot of places are mandating it, because we know that this is going to provide source control. So this isn't really to protect the wearer as much as it is to keep your respiratory droplets from going onto somebody else. And so there is the big question: what can you do as a school? How easy is it to do? Is it mandated? Is it not? What age groups will actually wear these? A lot of school systems have decided that everyone wears them. You can say over 5 years of age. Some places are saying elementary school children are unlikely to wear them, so they don't need them. There are other countries where children are used to wearing masks at all times, and so they wear masks at all time without having too many instances where they take them off. But I think that that's going to be something to be discussed when you think it should be enforced. And then, do you have the supplies? I saw a conversation a little bit ago about some of the masks that you have. Is there going to be enough masks for everybody, and how do you enforce that? So the big thing is going to be social distancing, and that's, I think, what's going to help us the most right now. Are you able to do that within your schools, or are they this classroom so small that you cannot put the kids that far apart?
Well, we are certainly going to try. This is Tedra, by the way. We're certainly going to try. That's one of the recommendations that our committee does have to the, our subcommittee does have to the overall larger committee, is to enforce social distancing as well as masks. I see a question in the chat from one of our board members, Mrs. Sarah Fortney. She's asked about shields. I guess maybe in lieu of, or just in addition to. Can you talk about shields for desks and what that would do to protect our students?
So that is a very good question, because we're talking about it a lot in our infectious disease and physician groups within a lot of social media, or even in the task forces that we have amongst ourselves. We don't have enough data right now to support it as compared to a mask. And if you think about it, when you wear a face shield, you can still probably have more of your respiratory droplets come down than when you have a mask, which should contain the majority of them. Now, is it going to be better than nothing? Yes, we think so. There are other institutions talking about plexiglass, so shielding the teacher in the front so she can communicate better with the students, not wearing a mask because she's going to be further away from the students. And then when he or she approaches a student, then they should be wearing their masks. Also, in some lunchrooms, especially in other countries, as we learn about what other countries are doing, they will put plexiglass in between the children so that they can take their mask off safely and have their lunch. So there's a lot of ways that we could try. I think that we need to try lots of different things, share our information, and then come up with best solutions, because I don't think it's going to be one solution that's going to be right for everybody.
Thank you.
It's Ken Alexander, and I apologize for having a little trouble getting on board. And I appreciate Dr. Padilla sort of stepping up.
I'm sorry, Dr. Alexander, if you can hear me, I had to mute you. There's a lot of feedback coming in. Can you try it again? You want to unmute yourself and then try it again? Try it again. No. You want to unmute and then try again? Okay, so while we wait for Dr. Alexander, obviously he's having some technical difficulties. There are some questions and comments in the chat over here. So someone said, Dr. Kadia, if you can hear me, someone asked about children being 6 feet apart on the buses. We know that that is not necessarily something that we can do on the buses. I know that we have our director of transportation, but is there a recommendation that you have or something from the medical community that you'd like to share with us regarding children being on buses and social distancing on the bus?
So we understand that that is going to be something nearly impossible for you to do. We know that the buses are crowded. So we have been talking about this, obviously. And as far as we're concerned, as long as we could do a good hand washing, and if you can do one child per seat, if that's something feasible, the whole aspect of putting one child every 2 seats, we understand that's not going to be able to do what you need to do in order to get all your children in school. If you can have parents, understand that they shouldn't send their child to school if they're sick as part of responsibility, that's what's really that's the best thing we could do. And if you cohort them also, so it's going to be the same kids on the same routes over and over again, that's also going to be very important.
Thank you. And then what about elementary school students? I know that you discussed that earlier. So one of the recommendations that my task force is making is that all students, including elementary and secondary students, meaning 6 through 12, wear face masks in addition to staff wearing face masks. Can you talk about maybe the difference between elementary or maybe, I know, 8 or under or 5 or under not wearing those masks and what that would do or if that would help at all?
Sure. So we believe that children are not as likely to transmit the virus. And this is based on the information that we have so far and also information maybe on other viruses. However, we don't have a lot of direct COVID-19 information. So we're just going from what we have. We know that other countries have opened up schools and have done well. Schools differ. Some masked everybody, some did not mask, some masked certain ages, like we're talking about, some did not. And so it also has a lot to do with your community and what's best. We think that adults definitely are going to be the higher risk to transmit. So we worry also about your staff members being the ones that are congregating and more able to share the virus amongst each other. And so for the younger kids, especially those under 5, they will have a harder time wearing the mask at all time and policing them and making sure they're keeping them on. And so perhaps if you have a smaller class size and you can keep the children together, so same people together all the time, it's something to discuss, because that is something that a lot of other districts are doing, is then the younger children do not need to wear their masks because we understand it's going to be harder. And again, we don't know what the likelihood of them spreading it is. We don't think they're as likely as older adults. And so that would be a good option to do.
Thank you. And what about students with disabilities? So here in Polk, we have 4 center schools that we call them. And so those are our students that are medically fragile and they have some severe disabilities. And so they may not be able to wear masks and staff may not be able to wear masks as well. What do you recommend, or is there a recommendation in terms of what we should be doing for those students and that staff?
So I think, again, a similar recommendation would be to keep those small sizes or those groups of very small sizes, because we understand a lot of people cannot wear masks. And this may be an instance where some face shields, if they're able to wear some, because they have, there's a lot of innovation going on right now. And so perhaps there are some other face shields that could be substituted in this setting, which may offer a little bit more support, not necessarily something that we are certain that will be helpful, but it may offer a little bit extra support. But the smaller group sizes is really what we think is going to be key in some of these situations.
Okay, thank you. I'm looking through the chat. And so Mrs. Frederick, we'll go back to Dr. Jackson in a second. Do-do-do-do-do. Oh, another question is from one of our center school principals, actually. Would you expound on the idea of cohort with regards to busing?
So Adriana, can I touch on that one?
Yes, you're back.
Yes, that has been a disaster. I apologize. So obviously the school buses are a problem because there's just no way to maintain appropriate distancing on a school bus. I think the best you're going to be able to do is limit it to sort of 2 kids on a seat. Make sure that they, hit a little bottle of hand sanitizer coming in the door of the bus, and that insofar as is possible, they wear their masks on the bus. Now, the one other thing you can do is that outside is good. I don't think there's any data for this, but one of the things to look at least when it's not super hot, is having as much air moving through the bus as you possibly can. So, if there's a time when windows can be opened and that kind of thing. But I think that the buses themselves are just going to be a challenge that it's going to be very hard to get around, because transportation budgets are limited, buses are limited, drivers are limited, schools in 4 weeks. And the good news is that for most kids, it's not a huge amount of time on the bus. So I think the best you're going to do is wash their hands, mask them, and put two to a seat rather than 3.
Thank you, Dr. Alexander, and welcome.
Thank you.
We know
And I apologize. The one comment I wanted to make, and Adriana, I don't know if you already talked about it, where we think the risk resides is, as I said before, I think the kids are going to be fine. Did you discuss this already, Adriana?
So I briefly touched on the fact that what is worrisome is the staff members congregating, and then they will be the ones that will be sharing the virus and becoming the ones that are infected.
Well, and I'd take it even a step further, that if you look in the state of Florida, there's been over 7,000 pediatric infections now. 2 children have died, and both of those were older kids with significant comorbidities, primarily obesity. There's been a lot of talk about this multi-system inflammatory syndrome, but in reality, this is incredibly rare. We've not seen a case at our hospital. They may have seen one at Orlando Health, but the point is, I'm not worried about the kids. The kids are going to do just fine. As you plan for your district, I'm much more concerned about the 58-year-old diabetic lunch lady. That's the person that's going to get into trouble. So most of what we need to do here, while we talk about the kids, it's actually protection of your faculty and staff. And so with that in mind, that's how I think you have to set up a lot of what you're doing. Now, somebody's mentioned cohorting already. I think this is a very good idea. There are some other things you can do. One of the things is insofar as is possible, rather than moving the kids around the building, move the teachers around the building. And that way you haven't got hallways crowded, you haven't got people talking to each other. You've got a much more controlled situation. As Dr. Kadia mentioned, the cafeteria is probably the most dangerous place because we've got to have our masks down to eat. And again, if kids can eat outside, if there's ways they can kind of control the flow through the cafeteria, I think that's going to be especially helpful. We will send to you, if you've not received it already, a couple of different publications. I think Dr. Kadia mentioned a science article just out recently. There's a wonderful body of opinion and summary from folks at Massachusetts General Hospital. I don't know if that's been received, but we'll pass that on. There was another one from the Opinion Center at Children's Hospital of Philadelphia. And if you've not seen it already, the folks in the Osceola schools have already sort of been down this pathway a bit further, and I would certainly tap into everything they've done. They've done a very good job. So I'll stop for now and get back to the discussion.
Okay, thank you. One of the questions that is in the chat is, what is your opinion of the number? So in terms of positive COVID cases, if we have one on campus or if we have a few on campus, can anyone that is not muted mute themselves, please? So for the doctors or for the medical professionals, when should we logically, I guess, shut down if we have a COVID or positive COVID cases? Is there a magic number, or is that dependent largely upon, I guess, our own procedures and protocols?
Adriana, I'll let you weigh on this too, but I think that what the number that's going to matter has more to do with the teachers and staff. And it really boils down to, can you maintain sufficient staffing to be safe? As far as the kids being sick, I think that's going to come and go. I suspect what we'll see is a flare of children being sick in the beginning with a lot of anxiety, and maybe things will slow down for a while, maybe a transient move to some electronic school, and then pick things back up in brick and mortar school. The challenge that we are going to have, and this is, I think, the biggest issue we're going to face, is a lack of testing. The state has turned around and said, well, we're just going to test everybody and they'll all get tested in pediatric offices. I got news for you. Pediatricians don't have testing. They can't get testing. There's a national shortage of testing. And if I send a test to Quest or to the Mayo Clinic or to LabCorp, I might get a result in 5 to 10 days if I'm lucky. And so the scenario that you and I are worried most about is on day 3 of school, some kid sneezes, some teacher gets worried and wants to get tested, and you've got somebody out of school now for a week. So I think what we've got to do is be very realistic as we go forward and say, look, despite what the state is saying, I'm afraid there's people with their head in the sand. And if they think that people are going to get tested readily, they haven't tried to get a test.
Thank you. And I have a few more questions. And everyone that's on the meeting, if you can, just go ahead and type your questions in the chat. We'll read them for the medical professionals. So what is the age group for kids, the cutoff teens versus elementary age? More so, the question is dealing with risk. So say 18 versus 13 or versus a 6-year-old. And I guess what she's more so asking is there a cutoff in terms of, let's say 14-year-olds are more at risk, 14-year-olds and older are more at risk than a 6-year-old. Is that, would you agree with that statement, or how do you feel about that?
I think as you do get older, your risk of symptomatic disease, if you get infected, increases. The difference is that you can talk to a 14-year-old, 15-year-old, 16-year-old about wearing a mask. So that's a place where you actually have some opportunity to control contagion in the environment. Younger children, they're going to touch each other. That's what kids do. So rather than parse it by age, if you look at the kids that have gotten in trouble nationally, the leading group is actually morbidly obese children. Teenagers, especially who are morbidly obese, those are the ones that get into trouble. People with significant heart and lung disease. Now, I'm not talking just mild asthma. I'm talking things like steroid-dependent asthma. People who are taking oral steroids or that kind of thing every day, they are at greater risk. People with congenital heart disease appear to be at greater risk. And oddly, to a lesser extent, people who are immunosuppressed, kids with cancer, kids with HIV. This is a complicated story. Usually you and I are used to thinking that immunosuppressed people are the ones that get in trouble. And yet there are kids, for instance, with inflammatory bowel disease who don't get into trouble at all. And very few of kids that have been admitted have been our HIV kids. So the kids I worry about are the kids with severe underlying chronic lung disease and the obese kids. Okay,
thank you. The next question is a teacher. So let me give you some context. Our classes, or I'm sorry, our schools range. We have some schools that maybe are only 35 teachers and then maybe 15 other staff. So let's say 50. And then we have other schools that have 150 in terms of staff. So let's say a teacher at the school, at our larger school, gets COVID or tests positive. And so obviously that teacher would have to quarantine that teacher would have to quarantine. Would the entire class also have to quarantine? Is that your recommendation? And then what about the other teachers that were in contact with those students as well? So maybe that's a question for Dr. Joy Jackson of the health department. Dr. Jackson, are you here?
Yes, I'm here. Thank you.
Uh-huh.
So what we would do is obviously interview the teacher to see how close the contact was either within the classroom or if they're still using the teacher lounge or the office. And our general rule of thumb is close contact is defined as being within 6 feet for 15 minutes or longer. So I actually have a question for Dr. Alexander about a classroom exposure. And they did mention that children are less susceptible. So I'm really going to put him on the stick here and say if we have a teacher that tests positive and has spent at least an entire day in a classroom, maybe she was pre-symptomatic. So we always back up 2 days before symptom onset to decide what are exposures. What is his recommendation about excluding the students?
So I'm going to comment, and then I'm going to let Dr. Kadia also weigh in on this because she's been looking at a lot of the school stuff recently. This is where the mask makes a very big difference. As you know, and thank you for your comments, that what we've done is a couple of things. Now we have to maintain a workforce in the hospital just like you have to maintain a workforce in teachers. So in the hospital, we say that caring for a COVID positive child or family member, if you're using personal protective equipment appropriately, does not count as an exposure. And indeed, what we've learned is transmission from pediatric patients to adult providers in the hospital is extraordinarily rare. Where healthcare providers are getting infected is from each other, most often outside the hospital, or perhaps in kind of cramped situations where they are sharing conference rooms and this kind of thing. What we've learned is that if providers are getting infected at work, it's because they're eating together. And so turns out that the masking process is quite effective. Now, you have to be very careful here because we could certainly quarantine ourselves right out of a workforce in a big hurry. So what we've had to do in the hospital situation is you send people home if they develop symptoms. That if you've been exposed, say you've got a family member that's got COVID or something like that, you continue to work until you develop symptoms, at which point you are sent home. You mentioned the risk of asymptomatic transmission. That's probably a real thing. The good news is that the transmissibility of the virus appears to be related to symptoms. So symptomatic people are more infectious. And again, I think there's a very strong belief now that masks really do work. And within our own hospital, in patients who are in providers who've been wearing masks, we have not seen provider to provider or patient to provider transmission. Dr. Kadia, do you have more on that?
Yeah, I agree with everything Dr. Alexander said. I think that there is not going to be a one shoe fits all. As we learn more from our colleagues in other countries, like I said earlier, they're doing all sorts of different things. Some schools are closing down after one student is positive. Some shut down the classroom. Some continue and just get rid of the patient, of the student or of the teacher. And it seems like whatever they're doing, they will alter that based on what they're seeing locally. So I think that what needs to be done is with the health department, figure out what it's going to be your strategy and understand that once school starts and you start seeing these cases, you will have to adapt and adjust. just like we have and everyone else. Like we said, we don't follow the general exclusion criteria from work in the healthcare setting, because then we wouldn't have staff. So a lot of adjustments are going to need to be made as time goes on.
Okay, thank you. So I think I have another question from Mrs. Yoakum. Uh-oh, I don't know who's sharing their screen. Is that me?
No, I actually think it's Miss Reyes, and she's fixing it. So
Okay, thank you. So with cases climbing, this is for the medical professional, with cases climbing here in Polk, and I think maybe this would be for all three of you. Would your medical opinion be to open school in August in a full e-school or virtual model?
I think probably the thing to do, again, we're on uncharted territory here, but I would probably, offer, first of all, I would offer parents three choices. The full-time electronic, kind of what we've done for school at home, where there's a regular scheduled teacher, and it's 8 in the morning till 3 in the afternoon, just like a virtual classroom. There's sort of the Florida virtual school approach, which can be done when it works for people, and if parents are only home in the evenings, then that's what they do. And then the brick and mortar option. And perhaps the thing to do is a gradual opening for the first week to 2 weeks to see what happens, is perhaps do an alternating day opening, especially for the younger kids, where they're going to have to learn a new set of rules. For high school kids, you can sort of direct them around the building and they can figure out which is the upstairs case and the downstairs case. For the younger children, it might be worth, for the first week or so, doing an alternating day opening, if that's feasible, so that you can sort of get the ground rules out there. And by cohorting, if people are getting exposed, you're only exposing a portion of the kids at the beginning. The challenge, again, that we've got is that if you look at the predictions for what's happening in Florida, there's going to be sort of, unless there's a big upswing in mask use in Florida, we are going to continue to have, or perhaps slightly more, disease activity in the community out through September and into October, which will then increase if there's not, again, more widespread mask use.
Dr. Jackson, do you
Can
have
I?
any? Oh, go ahead, Dr. Hines. I'm sorry.
Oh, no, it's Khadija. I just wanted
Oh,
to add something that I don't know if it's an option or not, but looking at what other countries have done as well was ease into it by opening up first daycare centers, elementary schools, middle schools, and then high schools, and staggering them. I don't know the whole logistics behind it, but one thing you could think about is then you'd have the other staff members from the high schools and middle schools opening up later that could perhaps help with the logistics in the elementary schools and then the middle schools, and just making sure that, like Dr. Alexander said, everyone understands you come in this door, you go out that door, to decrease the density in special areas. So I don't know if that's an option, but it seems to have worked in Europe. Denmark, Netherlands did it this way, and they were able to have success.
Thank you. Okay. And then I have another question in the chat box. What about wearing cloth masks? Do you think there would be the same low transmission rate with teachers wearing cloth masks instead of the medical masks that are worn in the hospitals?
Adriana, you probably know more about that than anybody.
Okay, thank you. So the reason that we wear the medical grade mask in the hospital is because we will be also at a higher risk of having increased exposures and being in close proximity to each other or to the patients less than 6 feet, where splashes can occur. So the medical grade masks are protecting us and protecting everyone else in the community. cloth masks, which are to provide source control. So just to protect the other person so that when I'm speaking, I contain all of my secretions, are very effective. And that's what the new research shows, that just by using these cloth masks, we really are going to be able to decrease the transmission rates. And I'll add that at the hospital, at least in our institution, only if you have clinical care with patients within 6 feet, or you expect that. Otherwise, you will wear the medical grade mask. Otherwise, the cloth masks are allowed in our institution.
Okay, thank you. Is there, I guess,
important caveat here too.
Sure.
And that is, first of all, we're very pleased to be doing this and honored to participate. You guys do have an outstanding health department in Polk County. And, I do want to be very clear that while Adriana and I are eager to participate, it's the health department that ultimately is the decision-making body. And we are happy to talk with you, and we will work with you through the health department as well, because we know a lot of those people and they're our friends. But so I just want to make sure that at any point, if there's a difference in opinion between what Adriana and I are saying and what you're hearing from the health department has jurisdiction, and we respect that.
Hey, Dr. Alexander, this is Dr. Joy Jackson. I'm the director of the health department. I know we've met several times. You've been over and done some conferences for us. So I've just been sitting here listening and taking notes, because I think you have a unique regional perspective, and also as pediatric infectious disease. So I do have some additional questions that we can either talk about now or offline. And the one thing I would weigh in, because as an internal medicine physician, I'm more used to dealing with adults. And I think back to the question about whether teachers should wear cloth versus surgical masks. I think they should at least wear cloth. But if teachers have underlying health conditions, they may be a bit more protected by surgical masks. And my suggestion is that the teachers have the ability to sort of make their decision about which they wish to wear. That's the only thing that I would potentially add from the standpoint of being an adult physician. But anyway, but thank you. And I do very much appreciate you guys are on here and listening to your comments.
So I thank you very much. And I agree completely. Adriana, the point Dr. Kadia is making, I think, is an important one, is that the mask serves two functions. It, to some degree, protects what's coming in, but the surgical mask, the cloth mask, mostly reduce what's going out. And so I think that's perfectly reasonable. The loop masks, the little blue ones, are inexpensive. They're disposable. They work well. What I wouldn't do is recommend that anyone be using an N95 mask. That's an expensive resource that, in studies of N95 mask use outside of the healthcare setting, it actually affords no benefit. So you're spending a lot of money. There's a lot of bogus N95 masks out there. And the other challenge that you'll have, and this has been a big problem in the healthcare setting, is that giving people masks is not unlike passing out peppermints to children. That you can give 9 of them a red peppermint and 1 of them a green peppermint, and everybody wonders why they didn't get the green peppermint. So one of the things about personal protective equipment is that it has to be very democratic.
That's true. So Dr. Alexander, if I may ask a couple of questions. We do have a number of ESE students. Some, we have several with trachs. We do have students that require nebulizer treatment, but just to talk about the ESEs, I had recommended to the district that those staff that are working closely with ESE students, particularly who have trachs or respiratory issues, should or could be recommended to potentially wear N95s, depending on what they're doing. I almost view them as being a healthcare provider. Would you support that? But that would be extremely limited.
Adriana?
So the caveat with the N95s is there a respirator program to ensure correct fit?
Correct. Well, I don't know.
Would they be able to do it?
Yeah,
right.
Go ahead.
So if that's available, then in certain instances, I do understand that they, well, that's what we do in our situations, right? In our settings. The thing is, if it's not properly fit, you may be providing somebody, or somebody may think they're being protected when they're not. So I would suggest that if it's going to be done, then we could figure out a way to give them fit tested.
That and eye protection to go with.
Yes, sir.
And so what we're using in cases like this where patients are being suctioned is an N95 mask and then a face shield or goggles rather.
Yes.
The other thing, Dr. Kadia, can you just, because we don't want to run the Osceola school, or sorry, the Polk County School District into the red over N95 masks, can you talk just a little bit about the elastomeric masks as an option and what's entailed with their use in cleaning?
Sure. So the elastomerics are half face shields. Face masks that provide at least the same protection, if not more, than the traditional disposable N95s, with the positive finding that they are reusable. They just need to be cleaned appropriately. You can fit test them just like you would a disposable N95, and the cost is significantly attractive. I believe they're somewhere around $15 to $20 each. So once you're able to acquire these, if you could do respirator fit testing, this would be a very good alternative, because so you could assign one to those limited few providers, teachers, staff, and provide them with the instructions on how to take care of these, and they would be able to use these, which again provide at least the same, if not better, protection against particles, with the same caveat that they would probably want to use the face shield or some sort of protection on top of those. But that's a move that a lot of places are having to go to in the shortages of these disposable masks, and they have been used in other healthcare systems and in protection against tuberculosis patients effectively for years in other hospitals. That was it.
So by elastomeric masks, Adriana, so you're talking the N100?
No, the elastomerics, they're kind of, I guess, yes, to explain them better. They look like the ones that are you could buy them at Home Depot, and there are some of the ones they use more for gas protection, so they're not generally used in the healthcare setting. They have an exhalation valve in the front, and then they have two canisters generally on the sides, and so they've been adapted somewhat so that we can use them in the healthcare setting to provide adequate care.
3M makes one. It looks like something you'd use to spray pesticide. Mm-hmm. I suspect you probably got some in some of your maintenance facilities in the district.
Good morning. This is Dr. Stanky. Can I interrupt for just 1 second? Considering that I have oversight of the ESE students and the center schools and our health services team with Audrey and Dr. Jackson, could I propose that we possibly have a follow-up smaller conversation with just a few of us, just to specifically talk about our students with trachs, our center schools where they have to do diaper changing, which also occurs in other schools as well. A lot of the kids that we have across the district beyond our center schools where that's going to happen, we have very specialized staff that support those kids and do that might need those different pieces of equipment. And I know we already have ordered a lot of PPE, and Audrey would be able to tell us what that is, but I think we could have that conversation with a lot less of us and not go off on a long dovetail here in this meeting. So that's just my proposal. Thanks.
Thank you, Dr. Stanky. Dr. Jackson, do you have any more questions for either Dr. Alexander or Dr. Kadia?
Yeah, I do, and I don't want to dominate this, but these are we have a lot of students that are asthmatic. Obviously, a lot of nebulizers, and we are encouraging parents, obviously, to go to a metered dose inhaler, perhaps with a spacer for kids that can't maneuver them very well. But in those situations where we will need to do nebulizers at school, we bantered some ideas, including potentially if you've got an outside door, do the nebulization outside. or the school nurse setting the student up for the nebulizer and then leaving the room, but then we've got an exposed room. Do you have some suggestions as to handle when we do need to do nebulizer treatment?
Adriana, you've probably done more research into this than I, but the bottom line is in the younger kids, when adults get nebulized, they do aerosolize a degree of respiratory secretions. Younger kids, when they've looked at this, what they're aerosolizing is really what's in the aerosolization chamber. And so the nebulization of kids is considerably lower risk. I think your idea of doing as much as possible as you can out of doors is absolutely correct. There's a saying in chemistry that the solution to pollution is dilution, and the same applies, I think, in infection. So if you can do things like that outside or in a very well ventilated room, I think that's good. And before Dr. Kadia comments too, one of the things that will probably be important is as you assess kids coming in the building in the morning, is a process, and you're going to have to beef up your sick room process a little bit for kids before they get picked up and sent home. But Dr. Kadia, more on nebulizers and MDIs?
Yeah, so I touched briefly on it earlier, but didn't expand on it. So there is a theoretical risk of aerosolizing virus during a nebulizing treatment, but there's still much to be learned about this. Some places are still considering it an aerosolizing procedure, while others are not. In order to err on the side of caution, just like you stated, and Dr. Alexander supports it, and I do too, if you can find a room outside somewhere where there's good air ventilation, that would really afford us with the best protection possible. And then, yes, push as many people as you can in order to change over to the MDIs, which is really what a lot of places have done. I know that there was a shortage for a while, but from my understanding, I believe that they're readily available again.
All right, we also have some questions in the, thank you, everyone. So we have some questions in the chat. I just don't want to miss them. Hold on for 1 second. Revisiting this question. So Dr. Jackson, on a local level, what are your thoughts if we can open the school safely, knowing the COVID case rise here in Polk?
Well, I do have to admit that I've got concerns, but I think that this decision has been made at the state level. So that's, a policy decision from the state. And I think what we need to do is just do our best planning, which we are doing, to support our students and our staff and our teachers as safely as possible. So I cannot pass judgment on decisions. All I can do is provide guidance and support and be there when there are cases.
Okay.
That's really all I can say.
I can probably speak a little freer here because I don't answer to the state, but yeah, I think there is cause for concern. I think the challenge we have here, let's be honest, this disease is going to be with us for the next 1.5 to 2 years. And even as we talk about vaccines, it's one thing to get a vaccine. It's another thing to get vaccine into people. Americans want a vaccine until they have one, and then they don't want it. So we're going to have the very challenge of getting people immunized. So I would plan on what's going on here for at least the next 18 months to 2 years. And so now we are really facing the situation of the proven benefit of our schools. And it's not just education. You guys know that better than I do. The schools are socialization, the schools are safety, the schools are nutrition. The schools prevent mountains of child abuse. There's all sorts of important things that you guys are doing. And so in the risk-benefit ratio, I think the risk-benefit ratio for children is very low. That the majority of kids will probably get an infection at one point or another, and they're going to do just fine. The risk to the teachers is higher, but at that point, we mask them, they wash their hands, we teach them the best infection prevention we can give them, And then we say, look, there's going to be sort of a gradual rate of people getting infected over the next 2 years. And as long as there is sufficient staff to keep the building open, to keep the kids safe, to keep the educational process going, as long as there are rooms in our hospitals to provide care for people who get very sick, I think we're going to have to march on ahead, because we can't stop schools for 2 years.
Okay, thank you for that. Another question is, should we include our daycare programs in the mask conversation? So I don't know if you all know this. We do have a daycare service, not a daycare, it's health, Head Start. And so it is pre-K, so before kindergarten. And so we service probably about, I would say maybe 5,000 students across our district. And so what will be your recommendation for servicing those students and our staff in that environment?
So my bias as a pediatrician is Head Start is the most important grade in school. Believe it or not, my dear wife is a Head Start graduate, and this is now somebody with a PhD. So I think it's incredibly important. I think, again, here we've got an even more difficult dance, because, again, the kids are going to be fine. The kids are going to be just fine. Many of them come from families that are multi-generational. There are going to be parents and grandparents in the house. And so those kids will, maybe to some small degree, put their family members at risk. But by the same token, I think the benefits are almost greater there. Again, focusing on the teachers. And I think if there's going to be one hard thing about Head Start and early childhood education, that thing that you and I value so much in the early childhood educator, the physical contact, the hug, the somebody that'll hold you when you're crying, that's the thing we might just have to step back on for a while. But beyond that, I think full speed with Head Start, just put masks on the teachers. I think too, again, in a group of kids that tend to cough and snort, even some plastic glasses, some protective lenses would be a really good idea. I think that's appropriate in anybody, but especially in the younger grades. The good news too is a lot of your Head Start providers tend to be younger people, and so that will reduce their risk in the deal.
Thank you. And I only see one more question in the chat box. Essentially, one of the things that we're doing when students arrive on campus, if they do have a temperature of 100.4 or higher, or if they are then exposed to someone that is COVID positive and we know it, then we're going to isolate them. But the question is, if the recommendation is to leave the students in the classroom after a teacher exposes them, because students are asymptomatic, eventually every staff member will get infected. How will this tactic control the spread within the campus?
So again, there's a lot of complicated questions here, and so we'll talk about each of them. First of all, taking temperatures. We take every employee's temperature coming in the door. Now, taking somebody's temperature, as you're aware, depends on how you take it. In other words, if I take an oral temperature, a fever is probably somewhere over 99.5. If I take an infrared temperature on your forehead, what we've learned is a fever is probably somewhere over 98.5, because that correlates with a body core temperature of somewhere over 99.5. So 100.4 is what you might call a fever for an oral temperature. But again, you're not going to be taking oral temperatures on all these kids. You're probably going to be using some kind of infrared forehead scan. So what you might actually want to do is look at a slightly lower temperature. What we actually did with our employees is we took the first 500 employees coming in the door, took their temperatures, and then did a statistical analysis on that, essentially that bell curve, and said, all right, the top 1% of temperatures what we would consider abnormal, and we set a breakoff point on the basis of that. So it's a fairly simple statistical analysis, but if you're drawing a line at a forehead temperature of 100.4, you're probably not going to be sensitive enough. As far as children, again, transmitting to adults, Dr. Cadilla's looked at this in great detail. It seems to be a much more inefficient process that becomes probably very inefficient if the children are wearing masks. And again, you know, if we have to be careful how we define an exposure. And again, as Dr. Jackson said, an exposure is within 6 feet for more than 10 minutes, and some places actually use 15, with neither party wearing a mask. So if you're wearing a mask and you're around somebody that ultimately tests positive, I'm not terribly concerned. Dr. Cadilla, anything to add to that?
Wait, may I ask a question? Would you suggest that if we are doing infrared temperatures that we should lower it to 100 rather than 100.4, or can you give a number for that?
So I suspect it's a little idiosyncratic to the thermometer, but what we were using is in any employee who is 98.5 or higher, then they get an oral temperature done, and any temperature over 99.5, we referred them to employee health. Now, here we've got two problems. Part of the reason we used 99.5 is because we have our sister hospital in Delaware, and it was absolutely insisted upon that we be consistent with them, and the state of Delaware defined a fever as 99.5. As Dr. Jackson appreciates, what we've got here is a trade-off. The higher temperature we use, the fewer boogie-nosed kids with other problems we're going to pick up, but we're more likely to miss a kid with COVID. If we set a very low temperature, we're going to pick up every snorty kid in the place. So there's a line we walk. None of it's going to be perfect, but you know, with our infrared temperatures, we were using anything over 98.5 measured on the forehead.
Thank you. Okay, have lots more questions. Thank you. Let me get to it. In a shop setting, face shields do not provide adequate protection for physical particles flying into eyes. Those particles can fly around and get into the eyes or be breathed in. Can a face shield without a mask provide protection from microbes?
So, Adriana, why don't you hit that one?
Yeah, so I can't with certainty tell you anything because we don't have a lot of information out there, right? We do know, for instance, other countries use face masks regularly in order to control a lot of viral infections, and they've been able to mitigate a lot of their coronavirus disease this way. And in schools, children are used to wearing face masks, and so they haven't had too many difficulties implementing this care. However, there wasn't a lot of scientific evidence out there, but now we do have this evidence that's coming out in support of the face mask. However, we still don't have any of that scientific evidence for face shields. So, you know, if you look at it in the physics and everything, I think that it'll provide better protection than nothing. However, it's still not probably going to be as helpful as wearing a mask because the mask can contain the secretions a lot better. Anything to add, Dr. Alexander?
Can't hear you.
Sorry about that. So I'll give you a quick lesson in droplets and transmission. There's really three modes of transmission here that we have to think about. The first one is the one that draws the most attention and is probably the least important, and that's surfaces. So a bit of advice right up front. For many parents, their idea of a clean school is some guy with a wet rag wiping down lockers. And that is probably going to be the least effective thing you can do. The second mode of transmission, probably more important, is direct contact between people. This is why we're not shaking hands, because people touch their noses and eyes and then touch each other, and then we touch our own nose and eyes. So that's direct physical contact. I think that's something that is more common and is going to be a challenge in younger kids. But I think the bulk of transmission is through the respiratory tract with droplets. Now, when you breathe, talk, laugh, cough, all those things, there's sort of two sorts of droplets you produce. The first one are large ones, if you will, little beads of spit. And those travel about 3 to 6 feet. And then they end up on the floor. And this is why we tell people that 6 feet is the right distance for social distancing. And that is the bulk of transmission. There are cases, perhaps when adults especially are coughing severely, when they're being suctioned, when they're doing these aerosol generating procedures, that what happens are called droplet nuclei. And these are little tiny, tiny particles that essentially dry out and then can waft through the air at a distance longer than 6 feet. That's probably the minority of transmission. There's a lot of hoo-ha in the scientific community right now, with some people approaching the WHO and saying, no, this is a much more important part of transmission. But in reality, the fact that as we've brought about masking, we've seen a dramatic drop in the rate of transmission, it tells us that we're doing something right. Talking to my colleagues at Lurie Children's Hospital in Chicago, they haven't had any employees get infected from patients or other providers since they began recommending masks. So don't spend a lot of time with people cleaning surfaces. You're better spent policing people not having physical contact, wearing their masks, and distancing. As far as the face shield goes, the face shield in effect is another barrier. It's kind of like making the germ walk around a corner. So if somebody's going to be having a procedure where they're sectioning a tracheostomy, if somebody's splattering in some way, that shield is a physical barrier. But to the questioner's comment, I think the mask is still the single most important thing.
Thank you. And then I have a question here from one of our teachers. So he said, I'm hearing the words and meaning, doctors, I am hearing the words and meaning of the kids will be okay, but your words are sobering for the staff. If the child passes on COVID-19 to the staff, we will have no schools. So what is your opinion of the absolute best way to protect the entire staff, not just minimally?
So again, the best we've got here is very much what we're doing in the hospital. So everybody who sets foot on hospital property wears a mask. Patients, parents, providers, everybody, the cleaning lady, the office person, everybody is wearing a mask. And if you are, the only thing you're allowed to do without a mask on is eat or drink, and then you're expected to be distanced from other people. So the masking does make an important difference. Hand washing is also very, very important. If you're caring for patients, then we move from a cloth mask to a surgical mask, one of those loop masks. If you're involved in an aerosol generating procedure, then what you do is you wear goggles and a mask. We recommend a shield over your face and then a gown and gloves. And in doing so, again, we cannot find any cases of providers becoming infected from children. Again, the thing that if I were a school teacher, well, I can tell you as a pediatrician, I feel safer in the hospital than I do at Walmart. And so if I were a teacher, I would actually be much more concerned about what I do at home, what I do on the weekends. Again, all of our providers that have been infected from their friends and people outside of work.
Thank you, Dr. Alexander. I think that there's a couple of items in the chat around temperature taking, and as students directly come off, say, a hot bus or Potentially they've been outside in our Florida summer heat. Is there a recommendation about a time to delay a temperature taking for students before they get off the bus, before they come in from, perhaps they walk to school, things of that nature?
Well, that's a great question, and this was an issue that our colleagues in Osceola County struggled with, because that's a lot of people power, just taking kids' temperatures. And what they decided to do was, don't let perfection be the enemy of good. And so what they're doing is sampling kids' temperatures through the day. Not everybody's necessarily getting it taken at the door. What they were going to do is sort of rotate through who gets it taken at the door. One day it's the bus kids, the next day it's the walkers, the next day it's the car kids, and that kind of thing. You're right, there may need to be a little bit of a cooling off period, but in reality, if you got everybody's temperature taken even in the first few hours of the day around the school, I think that's honorable.
Thank you. And we have recently heard some other updates from our neighboring districts about just sampling of temperature taking. There are some concerns about just balancing the logistics of keeping our safety parameters in place. Many of our schools have a single point of entry throughout the day. And so maintaining those safety precautions while also balancing health and wellness, and perhaps doing those samplings and periodically throughout the day provides schools more flexibility. So thank you for that response.
We also have a question about fog machines. I'm not sure if you could speak to if they are able to sanitize effectively or not. Are those more recommended than wiping down, in addition to the masks that will be worn?
I think the benefit may be dubious. I don't know of any large studies. Again, I think that, and I'm pulling these numbers out of the air, but we'll see what Dr. Kadia says if she's in the same neighborhood. But I would say that respiratory transmission and masks is probably 80% of the problem. That hand touching and physical contact with people is probably another 15%, and inanimate surfaces is actually maybe 5%. Doctora, what do you think?
I actually think it's probably more respiratory and even less surface as far as what we understand and all the information we're gathering, but somewhere around that. But yeah, I would put, again, more weight on social distancing and the respiratory droplet aspect than any of the other modes of possible transmission out there.
Now, don't spend a lot of money on cleaning surfaces. Take those resources and use it to keep kids apart. And we've got employees that are spending their days walking through the hospital essentially as enforcers.
Tedra, you're on mute.
Thank you. As Amy Hardy has said, Dr. Jackson and Dr. Kadia and Dr. Alexander, we certainly appreciate you and taking so much of your time today for just answering some of our questions. As you can see, we've had a lot of very robust conversation in our own meetings, and we just wanted to talk to you and get your opinions about some of the things that we've been thinking about to help protect not only our students, but most importantly, our staff as well. So if you have any final points that you'd like to share with us, maybe any best practices that you haven't shared that we've not touched on that will be helpful, and then we can go from there.
No, I think you guys are doing a very good job. It sounds like you're being very thoughtful. And again, our goal here is we're not going to be able to protect or prevent everybody from, every child and every teacher from getting infected. That's just the way pandemics work. None of us is immune to this. It's been a real challenge in my life, actually convincing my surgical colleagues that the rules of infection apply to surgeons just like everybody else. and that if they're not careful, they are at risk of infection just the way everybody else is. So our goal here is to control the rate of infection as best we can, to keep it as low as we can, but still keep kids in school and keep teachers and staff healthy and keep kids in school, but recognizing that if someone gets sick, this is not a failure on our part, right? These viruses have evolved to do exactly what they're doing, and they're very, very good at it. So whatever happens, don't feel that a child getting infected or an outbreak in a classroom is a failure on your part, right? These viruses have evolved over thousands and thousands of years to do this. I think if we have a problem, it's a societal lack of foresight, and the virus is going to take complete advantage of that. Tedra, what we can do, I don't know if Dr. Kadia sent them to you already, but there were a number of papers and things like that. If we can get your email, we'll send it to you that could then be distributed to other folks, or who's the right person to send it to, I guess is the question. Oh, you're on mute.
Mm-hmm. You can send it to me. I've been communicating with Dr. Kadia and Maria, I think. And so she has all of my information already. And then I'll make sure the whole group gets it. But we really, really do thank you for your time today. And we just appreciate all of the information that you've shared in terms of helping us make better decisions for our staff and our students. So many thanks to you.
If there is a public meeting, if you're going to have an open school board meeting or whatever, we offered and they took us up on it in Osceola County, and I don't want to speak for her, but I know the answer is yes, that Dr. Kadia and I would be happy to participate in that as well.
Yes, and Dr. Alexander and Dr. Kadia, we thank you both. Of course, we greatly appreciate Dr. Jackson as well, and our health professionals. I was supposed to give a little reminder each time, but we have been recording these videos and we put them up on our website. So this conversation today will be very beneficial to our public, our community. And so again, we greatly appreciate it. And thank you for underscoring the importance of education and then really focusing on those best practices, those recommended practices that we can implement to protect our children, protect our staff, and ultimately protect our community, because it is complex and it is challenging, but I greatly appreciate our health professionals. Y'all are continuing to provide, provide for our communities and take care of our communities. And so we can learn a valuable lesson for how you're going about protecting your workforce and continuing to take care of us. So we appreciate that.
One other quick comment. Thank you very much. To begin, one other quick comment, and this is going to be especially important for Dr. Jackson to work with you. The only thing worse than a COVID outbreak is going to be a COVID outbreak with a measles outbreak. So one of the things I would strongly encourage is to work with your local immunizers and be utterly hard-nosed about kids being vaccinated to start school. And that includes the kids that are doing any kind of virtual school, because, a measles outbreak would be catastrophic, not only for our kids, but if we're a tourist industry trying to open back up and you're a tourist and all of a sudden you're hearing about a measles outbreak in Florida, you're going to go to Algonquin Park instead.
Certainly, we'll take that into consideration and make sure we make the recommendations accordingly. So we're going to end this session now. I don't think we have any more questions in the chat box. If we do, I'll email them to you all and provide responses back. But again, many thanks to you. And we're going to go ahead and continue with the rest of our meeting. And you are more than welcome to stay if you'd like to, but I'm sure you have some other things to do. But we thank you again for your time. and for all of the information. So have a good day, okay?
Thank you.
So I'm going to turn it back over to Michelle. Michelle, you want to go ahead and take over now?
Certainly. Thank you so much. I'm going to share my screen here. And the executive order has been referenced in the conversation this morning. And so we did receive an executive order from the Department of Ed, and it's Executive Order 2052. And the basically reopening requirements, the directive was for all schools open in August, at least 5 days per week for all students. There was an emphasis placed on the panoply of services that we provide. I think that was kind of one of the things Dr. Alexander was alluding to in his comments on the risk-benefit ratio of schools for children. And so all the various supports that we provide to our students, especially our students in many different types of fragile populations, are listed there, and that was outlined in the executive order. There was also emphasis placed on progress monitoring. So we do have statutory requirements that have us monitor the academic progress of our students throughout the year, and whether we are in a face-to-face setting or a virtual setting, those progress monitoring requirements will still be in place. So we'll have to navigate getting those types of things for our teachers and parents in the room or in the meeting. You may be familiar with things such as our STAR testing, which is a brief screening of reading skills and mathematics skills that we give at the beginning, middle, and end of the year. And so even if our students are participating in eSchool, or which is a proposal we'll talk about a little bit later, we're going to have to find a way for them to be able to participate in those progress monitoring components from home. And then there was also notice given regarding our full-time FTE for innovative learning environments. We do believe that our proposal for an eSchool will meet those requirements, and so hopefully that will allow us to keep our full funding when we have our next survey check in October. So I'm going to keep moving along. I am not able to see the chat while I'm sharing my screen. So if there's something there.
Michelle, this is Stephanie. I want to jump in too. I was on the Department of Education webinar yesterday, which I think is the same presentation that they gave superintendents Tuesday with some more fleshed out questions. And it sounds like they weren't going to be outrightly denying plans either, that they seem, at least, face value, that they, if a plan didn't fit some of these requirements, that they would work with districts to help fix that. But but in looking at our plan moving forward and talking with our state union policy and legal departments, I think Polk is going to be okay with the plan that we're going to present.
Yeah, thanks, Stephanie. We are hopeful as well in our talks, and we are expecting a release of hopefully some more information tomorrow about exactly what the template might look like, and then also we have to verify the plans of our district-sponsored charter schools as well. So a lot of moving parts around that, but we are going to work collectively to hopefully make sure that we all are meeting the requirements so that we maintain that funding. That's very important as well, so that we, that funding is what allows us to pay our staff and support our students. So that's crucial. So we think we will be in good shape in that regard. So. All right, so that kind of takes us into the work of our instructional subgroup. Very honored to have worked with that group. Great people, lots of robust discussion. And so in our work, we are coming forward with basically 3 recommendations for instructional models. And so the first would be what we're calling campus learning. We had a lot of discussion around even omitting the word traditional school, because we know that even when our students come back to campus, as we help them learn to wear their mask properly, social distance, maintain space while they're in lunch lines and all sorts of those parameters, it won't necessarily be like it was when they last left school. So we wanted to honor the work that'll have to go into those environmental supports, as well as the social and emotional supports that I know we'll hit on a little bit later. But that's campus learning is brick and mortar. You will note that that's pre-K through 12, so our preschool programs were brought up earlier. At this point in time, we have not been given flexibility for an option with pre-K. They're still saying it's voluntary. Pre-K has a minimum of 3 hours face-to-face requirement each day, and that's tied to their funding. And so we're working around those concepts, but that pre-K is included with the campus learning model. And then we have our campus e-school, which would be 100% e-learning tied to a student's zone school of registration or enrollment. So for our families that may have applied for a controlled open enrollment, a seat in an academy, a magnet choice program, they would be able to maintain their seat, but continue distance learning. And we're recommending that this is a quarterly commitment, a little more fluid, so that, if a parent decides in October that they're feeling comfortable and ready to send their student back, they'd have a little bit more flexibility as opposed to Polk Virtual. So Polk Virtual there is also still an option. It is full-time, and they are geared more around a minimum of a semester commitment. So with that, a few more details that our group was able to capture within a table. We're sending this over to PR to see if they have any recommendations to beautify this a little more before it's released to the public. But this is basically the nuts and bolts of our different programs, so parents can kind of see at a quick glance where there might be differences, where there might be similarities, how each program follows our Florida standards, follows our local board-approved school calendar. Each one also does have to honor our state testing requirements. Attendance is recorded, and the grading policies and report cards will follow the full scheme of our district policies. So we're going to have to be very clear with parents that the emergency status of the instructional continuity plan in Q4, where we had some lenient grading policies to help support that swift transition. Those are no longer in place, and that we need to hold students accountable for those instructional hours, the instructional requirements, the assignments their teachers put forth, so that we can justify to the state that this option is viable and can be supported through our FTE funding. Also, our supports for students with IEPs, 504s, gifted plans, English language learner plans, transition services, all of those plans are being made to support all options. Our Polk County teachers serve in these capacities. School athletics and extracurriculars are an option. They must be tied to their zone school. So, for example, if you are normally tied to Bartow High School campus e-school, then you will participate in athletics and events for Bartow High School. So we have some strict FHSAA rules we must follow in that regard. So Mr. Talbot and even Beth Cummings and some of our other directors that support athletics, fine arts, the extracurriculars, they've been very supportive in helping in those regards. Our school meal program at this time, due to the USDA waivers ending and our logistical structures, will be provided during the campus learning portion. If we get some changes with that, or if we had to go in emergency status, Mr. Davis and Ms. Kazmarski and their team would certainly update us, but for now, that is where we are. And school transportation, of course, would only be necessary if you're attending campus learning. Some of our special program participation, we'll definitely be able to maintain that in campus learning, but campus e-school, because we have so many robust and unique programs across our various schools, students and families are really going to want to touch base with their local school about their particular academy or program to see if there are going to be times where they have a face-to-face requirement, or if there are things they'll be able to maintain through distance learning. So while, we believe for the majority of things, the campus eSchool will fully be able to support that setting, it's kind of back to that one size doesn't fit all always. And so we want to make sure that parents have that dialogue with either their academy teacher or their local principal to ensure the expectations are clear in that area. Structured class time is required for our campus learning as well as our campus eSchool. So there is a clear expectation that students will need to be working on the typical school hours. Most elementary schools are somewhere in the neighborhood of 8 to 3 or 7:45 to 2:45. High schools around 7 to 2. That is your expected work time, and we must document those instructional hours and that commitment to the state. And so that will be the expectation. If parents are needing a more flexible class time setting, then maybe that is where they would think Polk Virtual could best meet their family's needs. And then it's very important to us during this time to maintain our family and school partnerships. Even though we might be distant, we still are connected with our families and the important role that those partners, that partnership is in the life of our students. So that will need to happen and be maintained in all settings. We may have to do some things virtually. Those orientation and open house events, might have to happen with the teacher and in a setting much of like what we're doing right now, but they're still very important events and they need to happen for the life of our schools. And then we want to be clear about parents serving as a learning coach and monitoring their students' daily progress. It's going to look a little different if they choose the campus eSchool model or the full-time Polk virtual model. There is a more active role in making sure that your students logging on every day, those assignments are getting completed in a timely manner, which is a role that will be a support to the teacher. Of course, the teachers in those settings will be checking on that, but in the classroom where the teacher can walk over to the desk and remind little Michelle to get focused and get back to work, that's a little more challenging for a teacher to do if a student's logging on from home. And so the parent would have to help us out in making sure that their students logging on each and every day. So just want to make clear the teacher is still serving in that active capacity of monitoring students and calling and emailing and reaching out, but the parent will definitely have to partner in that regard to help us out as well, should they choose that option. And so that kind of wraps up the big picture for our group. We also have FAQs for families around each option. The Polk Virtual School website has been updated and continues to be updated to meet the needs of our families. Mr. Davis and his team have also developed deeper FAQs around transportation because we anticipate families will have a lot of questions around transportation. So again, our PR department is working on those to make sure that that they're very, very clear and that they're ready for publication after we get the final approval of our plan so that we can begin sharing this information with the community. So if there are any specific questions about those options, that's a big, again, just a big overview. And again, very proud of our team and appreciate all the hard work. I see Ms. Collins and Mr. Talbot's comments, so I will definitely update that. We did catch those updates in some of the FAQs, so we'll make sure that those are aligned. So thank you so much to both of you for that feedback. And at this time, go ahead, Stephanie.
Sorry, real quick. I just, because we do have the FAQs that address things in more detail, but just as a quick overview before Dr. Stanky moves into whole child support, we really wanted the structure to be there for eSchool because we wanted teachers to be able to teach kids, not just monitor, an assignment. And so, grading is going to be like it would be in campus learning, where you have your own grading policies and your own late work policies. You'd be taking attendance and you'd be interacting. So, and we're going to be working out how that looks, where you have live recordings possibly, but I also want to ease some fears that we're also not suggesting that we have a mixture of you having in-face children, face-to-face children, and an e-school period mixed together, because that would be a nightmare. And so the intent here and how we're going to really work hard to schedule is that if you're an e-school teacher, you have virtual students. You're not going to have a mixture. There might be some small places where maybe you are face-to-face and e-school, especially in your high school electives. They may want to do that, but they wouldn't be mixing kids. You would like have an e-school period, and then let's say like Christy McCullough, she would have her equine maybe face-to-face, but that would be a separate period. So we're not wanting to mix face-to-face children with e-school children. So we know that workload would be terribly hard and immense for you. I didn't want to point that out because that's a question I've been getting a lot.
Thank you. Yes, and that is our ultimate goal, to mitigate that as absolutely best that we possibly can, even if that means from time to time some virtual teachers may share students from different schools if we needed to make that setting work out. So yes, thank you. And then just other questions in the chat.
Michelle, can I ask about dual enrollment students? I've had 3 parents whose kids already filled out paperwork for dual enrollment next year, 2 Polk, 1 Ridge, and they're wondering what they will register for. Does it depend on what they want to do? Like, is the dual enrollment paperwork still on file? You know, do they have to do that again? I got 3 questions about that this week.
Yeah, so we have John Miller, who oversees a lot of our accelerated options for the district. He's working on some of those pieces. If the colleges are offering online classes, then that's the format that students will most likely be able to take advantage of dual enrollment courses. So, but the IB courses, the Cambridge courses, the dual enrollment courses, we are working on some additional information for parents that have students in those settings. And then Steve, I see your message about Don Woods and Bill Duncan. Yes, we have several different unique programs throughout the district that we're going to need to potentially have some more flexibility with due to the nature of their work. So that is, yes, in the works, Steve. So thank you for bringing that up as well.
My question, Michelle, if we have a registration form coming soon, should they register for whichever option for our part of the school they're most comfortable, either virtual or in-present campus learning, and then the dual enrollment will be handled separately?
Yes, and
they don't need to re-register for dual enrollment if their paperwork was on file in the spring?
No, not to my knowledge. I think they're still okay. Thank you. Couple other questions. I think Stephanie answered Miss Fortney's question, but as far as not doing both, yes, that's our goal. Yes, Amy, Mr. Miller's still taking care of those dual enrollment requests. How are we going to be able to do orientation? So that is some of the pieces that it comes up kind of in our last slide that we're working on with, we will be working on with principals. As you heard Dr. Alexander state, that one of the concerns is, more so with adults. So bringing, adults on campus may not be our best method of doing orientation right now. So it may be better for us to explore some virtual options for orientation for families, unless there's a specific unique circumstance for a family where they need to, make an appointment. That's currently how we're handling situations at schools right now. If families need to enroll or see the principal, they're calling the school office and setting up an appointment. So we plan to kind of typically handle things of that nature. We are actually looking at structures of having all meetings for staff, contact day, things of that nature virtually, at least through the first semester, to try to help support our staff and lessen their exposure with other adults, as we're hearing that's more and more of a concern. So same would kind of go for buying shirts and things of that nature, Norma. It'll kind of depend on what option they're doing, but we're going to have to do some of those during appointment times and practice some social distancing. So much in like when we wait in line at Publix and we see the markings on the floor, we're exploring those types of things as well. All right, I think, Ms. Fortney, I think the question about waivers may be coming from around our current return to play and return to performing with fine arts and athletics. We do have high school students that are coming back on campuses in small groups. There is a form, actually it's an attendance, it's really just an attendance acknowledgement, and it's asking families, you know, if their student has had any symptoms in the last several days, and it's asking students to adhere to social distancing while they're at, you know, whether it be football practice or marching band camp, and wear their mask. And so, and to promise to not kind of congregate as those practices are ending, that they're leaving campus and listening to their coaches and directors who are conducting those things. So yes, there is a form out there, and we are actually practicing some of those social distancing and as well during this time. So I think one of the other questions that kind of came up was about, in our group, was about the hybrid model. And one of the reasons why, you know, we're thankful now after the executive order, it kind of depends on, you know, the opening schools and 5 days a week, but that would have been a much heavier lift for our teachers. And so as much as we can, we're trying to honor you know, the needs of our students while recognizing the work balance for our teachers as well. And so hopefully through this e-school model and just campus learning, we're able to be more flexible with that, to keep teachers focused on either one platform or the other. So, all right, thanks everyone, and I'll turn it over to Dr. Stanky for whole child supports.
All right, good morning again. You guys hear me? Thumbs up? Okay. I want to start out with thanking Dr. Henry, Mr. Duget, and Mr. Santiago for helping with our whole child supports group. We kind of split out into 4 smaller groups just to get some of the work done and knock it out. And they were very helpful in organizing and doing that for me and meeting some of the needs that we had in the discussion. So thank you to those gentlemen for that help. Some of the results that we have and proposals that we have for the plan, just to bring to your attention, there's a little bit more detail as well beyond this, but these are the highlights of it. In March, all of our principals created or had to complete a pandemic crisis response plan for their school that kind of outlined some areas of responsibility, how they would handle things with students as far as emergency calls and different things like that. So we've taken that plan and updated it a little bit, added some areas specific for the fall. One, identifying where they have to identify a contact for who would be responsible for student social emotional needs at the school. They added a timeline for the principals to assign and manage roles by the end of July, so they could update that. But it's basically a plan for principals to kind of walk through a checklist of things they need to prepare for school starting, specific to their campus for who kind of handles different responsibilities. And it goes right along. It's the pandemic plan that we had years ago when the flu came through. And so it's just the same thing. But thankfully, because they already did it in early March, literally like the week before we shut down, it shouldn't be too difficult for them to bring that back up and update it again this fall in alignment with our ICP and our reopening plan. Then when we went to our mental health group and some of the things that we were looking at there, we know that a part of the executive order and the reopening guidelines and everything, there's a very strong emphasis on reopening with trauma-informed schools and addressing the mental health needs of our students more than ever that we have, than we have before. I want you to know that our mental health team, led by Dr. Christy Olson, has already been working throughout the summer. They never stopped. They've been supporting students through the pandemic, responding to calls, and following up with kids who have been in crisis over the summer for various reasons. And at the same time, they've also been participating in their own professional development and gaining some new insight into trauma-informed schools to get us prepared for the fall. So some of that work that they've been doing will obviously continue. They've also developed their own multicultural awareness committee that they've looked at some of the trauma-informed staff training that they're going to be doing to make sure that we look at it through that lens. They've continued with youth at risk referrals. They've also been working with the Polk County task force and our community agencies to get resources out to families through our meals distribution. And they've been doing some work with our suicide assessment screening tool and some things there, and also getting a lot of resources put together in a library for our schools and our staff. So that work's continued, but there's a lot of things that we're also recommending to move forward and proposing for reopening. Again, it focuses on the trauma-informed schools plan. So we'd like to provide more training for our mental health facilitators that can then train our school staff in how to build and implement direct support to schools with a trauma-informed lens for our schools. We have resources through a Cognito platform, which provides online simulations of scenarios with kids and staff and things that happen that teachers can walk through and learn how to respond to situations. So when those students come back and they're demonstrating some kind of need, based on being gone for a long time, or things that have just simply changed in their family over time, or if they've had, some kind of trauma or some kind of serious situation where somebody in their family has passed away due to the pandemic or something like that, then just situations that the staff can walk through and learn how to respond to those things. We've also done a lot of work, and Christy's team has, with collecting and putting together a lot of mental health resources that we will link onto our district website. We're building a very specific page just for mental health resources, along with Rachel Pleasant and her team, to have those things on there. There's a Marjorie Stoneman Douglas High School down South Florida has a page like that, and a resource that we're kind of modeling after. So that'll be a great resource for our families and our staff. And then we also have a collection of books and materials that our staff already use called Cameron's Collection. So we're wanting to put that on the school board website for further access for more parties and things too. So there's a lot going on with mental health, but I think that we also have a lot available for us from the state. Our mental health allocation and our budget, they have increased that for moving into the next school year. So we're in discussion on how we will allocate those resources. They are very specific and can only be spent on mental health activities. So we'll be talking about what we're going to do with that. Can you take the next slide, Michelle? Sorry. Oh, did we miss one? I had a sec. There we go. Okay. Then our team also worked with the ICP. One of our responsibilities was to look at it and make sure that it aligned whole child support with the instructional components that were there. And so what Dr. Henry and Brandy Gogol and the team did was really go through, and they've added a lot of information specific to the instruction for our students on modified curriculum through Access Point. So I appreciate them doing that. We didn't get a lot of detail in that in the first ICP because we were, just honestly kind of trying to figure it out as we went along very quickly. But we've had some time to build that in, so I appreciate that. We will actually be adding some more to that, specific to how we provide related services and itinerant services for our students with disabilities and our students on Section 504 plans. So there'll be a little bit more coming with that, but it's work there with the ICP. Oh, sorry, back one.
Sorry, I thought I
And
was
then
the chat.
it's okay. And then
for our students with disabilities, there's just some specialized topics. We've had a lot of discussion about our deaf, hard of hearing population and our students, and how we're going to work with them and their teachers and their interpreters, obviously, especially with the masks and shields and communication, what that's going to look like. But we also know that we have a very strong district and school level staff that supports these students, and they will continue to collaborate well together on how that can work. They did a lot of work during, April and May on how to, if a teacher's providing instruction virtually, what's the interpreter doing virtually? They're coordinating things ahead of time so that the interpreter has access to the lesson prior to that and can then support the student. So we're looking at that, but then also discussion about literally the PPE that those staff would be wearing in the brick and mortar settings that would also make it still accessible for the students. So we'll have some guidance coming out with that. I already talked about the related services. And then we've also been having a lot of discussion. We know that there's going to be a lot of parents when school starts back up. They're going to be requesting information on services that their students may have missed during the fourth quarter and what that's going to look like, or any regression that students have had. We know that we have a responsibility, as we would with any student, to go and look and assess kind of where they are starting out the year, regardless of whether they have an IEP or not. But we're trying to develop some kind of protocol for school leaders and school LEA facilitators and contacts to really take their students with IEPs and say, okay, where are we starting at with you, and where did you end the year on? What did you participate in the summer, if anything, and where are they starting out the year, so that we can really say, almost kind of tier the students as far as groups of who to prioritize for meetings. Who do we need to really get in and look at and determine that they need an increase in services right now immediately, or they were really able to participate, did well, progressed, and they'll be able to start the year out kind of right where they were. So trying to figure out a way to do that, because we know that's going to be an immediate concern for our families when school starts back up. In fact, it already is, but it also is for our staff coming in, because they're going to be very busy trying to hold IEP meetings and reviews. So we want to hopefully have a procedure that they can follow along that makes some sense for them and prioritize their work. So that was the gist of everything that the whole child support team did. Thank you, my big team, for helping. Let me look at the chat box. Is there any?
Thank you, Dr. Stanky. While you're looking at the chat box, I just want to mention to the whole group something that I kind of typed in the chat. Ms. Higgins asked about parents selecting which option is their preference. And so we do have a plan in place for families to express their intent for their student and registering. And so as Mr. Hill said, kind of when we began today, after we present our recommendations to the board next Tuesday, then our goal is to get that out as quickly as possible so parents have time to respond, so parents have time to review the material and make an informed decision. And so part of what they want to hear are things that we've been sharing with you today about the instructional plan, and then as well as the items that Mrs. Porteous is about to share about the safety protocols in place as students transition to campus learning.
Good morning, everyone. So I was the chair of the health and safety operation team. And so thank you to my team members. We came up, I think, with a lot of great recommendations for everyone. As the PowerPoint or the slide suggests, we literally broke it up into the 6 stages of the day in terms of what happens before school, when students and staff arrive on campus, and when they move about campus, when they, what happens when they're in the classroom space itself. And then we did not get to talk about extracurriculars, but I know that Mr. Talbot can talk about that in great detail. And we touched briefly on when students and staff leave. So thank you to my group. It was really, really, I think, helpful for everyone just to work out and kind of get their feelings out about how to do this safely so that we can make sure that both our students and staff are really safe. So if we go on to just before school and pre-screening, so what does that look like? Essentially, our group recommends that everyone is screened either right when they get on campus or right when they are starting school. So what that means is everyone gets a temperature check, and then everyone obviously will then have a mask. So the temperature checks will have to be for bus riders, for drop-offs, for staff as well, and then for any students when they come on campus, and that's at all points of entrances. So we know that many of our schools have many points of entrances, so that may be something logistically that we may provide to principals to work out in terms of what is the best way to get all of the students in one area where it's not necessarily too compacted, and that will allow for social distancing, but will make sure that they maintain their safety in order to get their temperatures taken. So we are recommending that. Based on what Dr. Alexander has said earlier in the call, we may want to, though, lower the temperature from 100.4 to, let's say, 99. So we need to talk about that a bit more in terms of what that temperature will be, but we are recommending everyone does have a temperature, does have their temperature taken in the morning before they actually come onto campus. Those that test over whatever the threshold amount is, then we would put them in isolation and retest them. And then from there, if their temperature is still high, for staff, we would send them home. That will likely be some sort of COVID admin leave that we need to work out. And then for students, we will call their parents. It was a lot of robust conversation around whether or not we needed to include temperatures at the bus stops, because you know that we are a very, very large district. And so my group recommended that we do not do temperatures at the bus stops just because of the traffic delays, et cetera. We believe that if every student is provided a mask and then they get on the bus, that will at least allow for us to transport them to school. And one of the major concerns in not taking temperatures at the bus stop is, what about that first grader that is 6 or 7 years old that does not have an adult to go back to in terms of being at home? How does that work? And so we would not leave them at the bus stop anyway, even if they did test over the 100.4. So the thought was just to go ahead and bring them to school and then isolate them and go from there. So again, we will not test at the bus stop. We will test at the school, provide masks and hand sanitizers, as Dr. Alexander and Dr. Kadia has recommended. And that is for everybody. Next would be face coverings. So again, we decided to go ahead and recommend face coverings for everybody on campus, meaning staff and students. Based on the conversation today, I think we've not talked about this as a group, but one of the things that we may want to discuss as a group is what age, is there an age cutoff? So is it 8 and under? I know that other districts are doing 8 and under. Some are doing 5 and under, but overall, we do believe that that face masks should be required for all students and staff. And then we can talk about the age cutoff there. If staff does have some health issue, meaning let's say they have anxiety and they can't wear a mask, then what are the options for them? And what would that look like? So they could have, let's say, the shield that comes down that's not necessarily a face mask, and that would that would at least prevent them from having some sort of anxiety attack. So we did discuss that in great detail, but and the other thing that we talked about realistically with face coverings were the communication. So let's get the communication out early. Let's get it out as early as possible to parents and to staff, so that then they can make an informed and intelligent decision about whether or not they truly do want to return to the brick and mortar setting if they know that these requirements are in place. Some may opt out. Some may say, hey, I don't want that. We had April Sumner, who is a principal at Gene Odell, and she brought a good perspective. And her point was, many of my students that are medically fragile will not be able to wear a face mask. What do we do in those settings and in that setting? And so we talked about that as well. So it's not face masks, a mandate of face mask. I think we do have an exception, certain exceptions, particularly with our center schools or with those students that are medically fragile and that have some reason as to if they can't wear it, particularly with our students and with our staff. And so we need to be mindful of that and go from there. So the next thing is cleaning. We did agree that there was some discussion about cleaning. So one of our team members, Mrs. Fortney, brought up the fog cleaning compared to the cleaning every day. We did agree, I think Doug was on my team as well, Doug Doxson, who's over custodial services. We did discuss cleaning. So every school and every desk, every area will be cleaned every day. One of the things, though, if we do that, we may need more custodians at school sites to ensure that the buildings are cleaned adequately and properly. Because let's face it, our larger school sites, let's say Ridge, you have 3,000 students. They may not be able to get everything cleaned throughout the day. And so we did discuss that in great detail, but the recommendation is to clean every day using some sort of not hand sanitizer, I apologize, using some sort of sanitization method that would clean the desks thoroughly and clean the high point touch areas. So your doorknobs, your doors, any desks, any front office desks, things like that. And then also provide staff. So provide our front office, usually ladies, so I'm going to say ladies, provide our front office ladies wipes and things to make sure that they can clean throughout the day as well, so that it won't be such a monumental effort for our custodial staff. Next is transportation. So Rob was on there. The main thing that we talked about in terms of transportation was really, do we do the temperature checks at the bus stops and what that looks like? We know that there will be some social distancing on the bus. And then, so Rob, I don't know if you want to briefly discuss what the transportation recommendation will be.
Sure, thank you. Basically, as you said, we discussed the temperature checking of students before they got on the school bus, and that was a number of cons to that. We are going to ask the bus driver to take the temperatures and record that temperature before they ever step foot on the bus. And if they have a bus attendant assigned to their bus, that will be the same case. So if they do have a temperature, they don't contaminate the bus, and we can get hopefully a substitute driver to get that bus and still pick up students. The other is the hand sanitizers will be installed on every single school bus. We will have several windows in the front of the bus and several windows in the rear of the bus that will allow fresh air to be circulating, but we're also running the AC units that are on the school buses because it is so hot, and if you have all the windows down with masks being worn, I think it's going to be problematic. So at least we'll have air circulating and cool air coming into the bus as well. I can't think of the other two to a seat, which are going to create some logistical challenges getting students in to school on time. It all depends on how many are actually going brick and mortar and how many will be through e-learning or virtual. So that's my update. I may have forgot something, but if I did, let me know.
Certainly, thank you. The other, thank you, Rob. So the other issue is arrival and dismissal. One of the things that we did talk about are rolling arrival and dismissal times, meaning, let's just take secondary, for example, a middle school. If we do, let's say 6th grade, 7th grade, and 8th grade dismissal times, and this means dismissal between classes and also dismissal at the end of the day. We had a very, very robust conversation around this. I don't know that we've really decided per se on a recommendation, but we did talk about it, and I would encourage you all to look at the previous meeting that we had, I think it was Monday, on this topic. One of the main things that we really talked about, which goes into your area, Michelle, was block scheduling for secondary. So minimizing, one, the movement in the hallways and the traffic patterns within the hallways, but then also being able to release students so that they go to buses and go directly to buses. So right now, if you think about a release, let's say at an elementary, all the bus riders may go to the cafeteria. So instead of having the bus riders sit and congregate in the cafeteria, We may just say, hey, here's a bus number, and everyone goes directly to that bus. Or here are the car riders, here, the car is here to pick up Tedra Porteous. So Tedra then goes directly there. And what we're trying to do is really minimize the large groups at school and keep it down to a minimum if we can. And same for the arrival, not necessarily having one point of entry, having multiple points of entry, because again, we are still trying to take temperatures and everything. The other question or issue that came up during this conversation or this topic was, what about increasing or decreasing some of our instructional time to allow more movement and more people, because we know that it's going to take a longer time to do temperature checks, to make sure that everyone is in the classroom. And so what that looks like. So Michelle, that does kind of go into your area a bit, but I just wanted to make sure that that is out there for the whole group. Visitors, so we did not really touch on visitors. I can say though, if we go back to face coverings and pre-screenings, anyone on campus would have to have a temperature taken and would also wear a mask while on campus. And so we would probably minimize the visitors throughout the day. I know that that would severely impact, let's say, the activities that we do in an elementary school when we have grandparents, have your grandparents come to lunch, or, day with dads. I think a date with dads is what it's called. Nonetheless, we have to think about some of those practical implications, because all of those would be visitors on campus. All of those people will be gathered in the cafeteria. But based on what we've heard from Dr. Alexander and Dr. Kadia, if we have face masks, that may prevent a lot of the spread, even if we can't social distance. So that would be something that we will need to think about. The other thing is school nutrition. So we talked a lot about this. This was really a very, very lengthy conversation. On the table were two options. One, we could keep students in the classroom. And Stephanie, before you put anything in the chat, just wait for a second, okay? So we could keep students in the classroom and have them eat in the classroom. And Mr. Davis suggested that we, if we have a reduced amount of bus drivers and bus attendants driving, then maybe we can have those bus attendants and bus drivers come in and relieve teachers so that they would still have their duty-free lunch, right? So that was really the thought process. We were trying to make sure that we honored the contract as much as possible. We don't want to overwhelm any one employee group at all, and that is not our goal at all. So we're trying to figure out how to, I'm hearing feedback from someone. So we're trying to figure out how to best accomplish the nutrition aspect, because we know that so many of our students really do rely on not only lunch, but also breakfast. And so how we would play that out throughout the day. So one of the suggestions was to have breakfast in your homeroom, and then, but then the problem is your trash. So that would be a big component of that, the trash pickup. How would we now implement breakfast in a classroom, and then would the teacher be responsible, or would the school nutrition assistant be responsible? In addition to that, how would we deliver breakfasts to the classroom? Would it be the school nutrition assistant coming around on a cart and delivering breakfast to everyone, or would we have kiosks available? Like the logistics of that, we just really needed to work through some of that. And so so that's where we are with school and school nutrition. It's kind of still up in the air. We have not yet determined or made a final recommendation in terms of where the students will eat. We do know that it will be a grab and go of some sort. So if an outside eating option is available, let's say if the weather does permit, they can go outside and eat, or they can stay in and then grab it and come back in the classrooms and eat there as well. But we did really think about the duty-free lunch period and trying to work that out. And Larry Milhorn, the president of the AFSCME union, did agree and say, hey, that would be a good option for the bus drivers and bus attendants or anyone in that unit that would need some extra hours, because right now they only have the hours that are guaranteed on their goldenrod. So that brings us to traffic patterns. So traffic patterns in the classroom in the school building was really another hot topic that we discussed. So one of the suggestions I think made by Dr. Hines was that we have hallways kind of going in one direction. And so I think one of the, Chris Olson, suggested that that may not be feasible, particularly in secondary. And so that is something that that's how we actually then came up with the block scheduling. And that's where we believe that block scheduling would be best for secondary, because one, it would minimize the traffic flow in the hallways. And then two, we would have to do it on a rolling basis or a rotational basis. So meaning English, if you're going to an English class, then all the English people all the English students are then released. If you're going to a math class, then they are released, and you have 2 to 3 minutes in each rolling period to allow students to move throughout the hallway without having an over congested hallway. And the last thing is extracurriculars. So we did not get to talk about extracurriculars. I think though Dan is on the call. Dan, would you like to talk about extracurriculars? So
Dan, you're either you just had a helium balloon or something is wrong with your your sound.
Did you do that on purpose, Dan?
Okay, so we can't hear you at all, Dan. It is try again.
Tedra, maybe while we give Dan a minute, I'll just catch up on some of the things in the chat real quick, because some of them do cross over to instructional. And so when we're talking about block scheduling and how we might stagger lunch times, or could students potentially eat lunch at the end of the day, those are some of the things that we're working on a framework for principals, because of each school being unique, especially traffic patterns, things of that nature. Some of those decisions are going to have to be made at the school level with school-based leadership teams and faculty committees, because just simply the layouts of our schools are very different. And then also when we think about block scheduling or staggered release of time for changing classes, we also have to keep in mind that we know that we must honor those instructional minutes. And so while we may account for a minute or two here and there, we have to be equitable in how that impacts every class, so that we aren't inadvertently negatively impacting our instructional minutes, which could potentially put us in a fragile state with DOE as they're checking our plans. So those are all things that principals are probably going to have to put into their frameworks that we're working on, as well as lunch. If you're in a school where you have a very nice covered area, you could provide more outdoor seating versus a school that might only have picnic tables that are in the hot sun, and they might not have that option. We're going to have to, again, have a framework so that we are all being consistent in our implementation, but have the flexibility to address the unique logistical natures of schools. So hopefully that answered some of those questions, and we can see if Dan's able to communicate with us now clearly.
No, Dan. You want to log off and log back on and then try that? Okay.
Or we can transition to Beth Cummings. She's also on the call, and Beth and Dan have been working very closely. They both have similar plans for whether it's return to play or return to performing arts. So Beth might be able to share, since Dan's having a little technical difficulties.
Yes, good morning. Can you hear me okay?
Yes.
Okay, so we do have for right now for summer athletics and summer band camps, a very well, I think, thought out procedures. We have been working in tandem, Dan and I have been, and we are taking our information from the National Federation of High Schools, is they have given us some really good guidelines on what to do with those types of things. So right now we are limited to 10 students in a cohort if they are going to do anything inside, like a weight room or a inside rehearsal. So we can do proper physical distancing and that type of thing. We're also limiting the indoor type of movement to only 30 minutes currently, excuse me, to mitigate any kind of aerosol spreading. Most of ours for marching band, most everything will be done outside. Outside, they can have a group up to 50, but with that, they are spaced about 10 feet apart, and they are to wear masks unless they are playing. And again, there's no movement, they are not marching, but they can play as long as they are outside. Similar numbers for athletics, and of course, the FSHAA has also provided Dan some guidance on that. But I have documentation on that. If anybody is interested in that, just shoot me a quick email. I'm happy to share that.
Can you guys hear me now? All right.
Yes, much better.
So just to kind of recap, and I don't want to, basically what Ms. Cummings has said, we kind of work together this year to develop a plan. We are in small cohort groups, up to 10 total on the inside. We did add recently, if they're going to be indoors, to wear masks. We are up to 50 outside, but most schools chose not to do that. Many student athletes, basically football was the biggest sport, and they broke it down into offense and defense. So we're about 25 to 30 student athletes outside. We are not allowing any outdoor activities from 11 a.m. to 4 p.m. That was due to the Zachary Martin Act that went into effect July 1st, was the heat and safety law by the FHSA. So, and I don't want to kind of reiterate what Beth said, because we were both on the same page doing the same thing, and we worked well together, and it was great for that. But the FHSA just released what they called Plan B for the start of the season, which is going to give us 4 options of when we want to start extracurricular activities. Option 1 being July 27th, which is the first official day of practice. The second option is to start August 10th. The third option is to start August 24th. And the fourth option is to start extracurricular activities on September 7th. We do have the option to basically start cross country and golf different than we would probably football and volleyball, due to the nature that we can easily social distance in golf and cross country. Those will be easy to work around. Obviously, football presents some challenges. We do have a number of considerations from the National Federation that we're going to use. But the FHSA Plan B was just released yesterday at 4 o'clock. The FHSA board has to vote on them next week. I don't know if it will pass or not through the board of directors. But unfortunately, right now, the official start date for extracurricular activities with the FHA is July 27th. I do see that it will change, because the task force that myself and Superintendent Byrd are on, the recommended start date was requested to be moved to August 10th. So we're kind of about a week out to getting more information as it comes forward. Obviously, social distancing in football is going to be very difficult. We probably look at following all the National Federation guidelines, which is to wear cloth mask underneath the helmet. but we will work at those. I think it's more important that we do get a start date, but there are, as days go by, more and more districts in programs around the country are canceling football. So unfortunately, I don't have a definite answer for you right now, but I will keep everyone in touch. And if there's any specific questions that you need, you can put them in the chat box and I can answer them, or obviously feel free to reach out to me anytime and we can work on that. But the most important thing that I think the community and in our district needs to understand is we're going to take student safety our first priority in anything that we do. And I see us having a delay to the start of the season. I'm pushing for a delay in the start of the season so we can kind of figure this out. I would personally like to see how school is going to play out. I think a lot of teachers and coaches, we have the education is the most important thing that we need to focus on. It's extracurricular because it's extra, but we are going to take every safety precaution we can. But like I said, if there's any questions, please feel free to reach out to me if you have any concerns. For the principals that are on there, the athletic directors have been emailed Plan B from the FHSAA. So thank you.
All right, thank you.
Just to answer Rob's question, after the start of school, will practice not be able to start at 4 p.m.? The start of practice is going to be totally dependent on the weather. One part of the Zachary Martin Act is every single day, coaches and athletic directors have to get a wet bulb globe temperature reading. If the temperature is over a certain degree, we will be required to have 4 5-minute water breaks, 5 5-minute water breaks. We may only be allowed to practice in helmets and shoulder pads for 2 hours. We may only be allowed to practice for 1 hour with no equipment on. And then if the temperature is over another wet bulb globe, and it's not to be confused with the regular temperature, the wet bulb globe is an ambient temperature, which it measures heat stress, which takes into consideration the temperature, the humidity, the wind, the sun, the cloud coverage. And if the temperature is over 92.1 wet bulb globe, there'll be no outdoor activities whatsoever. They'll have to remain indoors until the temperature drops. The temperature needs to be taken 30 minutes prior to any activity starting, and then every hour after that. And anytime that temperature gets over a certain degree, then we have guidelines that we have to follow. So, Rob, to answer your question, practice could start at 2, or some schools may have to wait till 6 p.m. to start. It's going to be very tricky with the Zachary Martin Act. Our schools are equipped with everything that they need to follow the state law. We kind of understood that this was coming 2 years out, so our district is well equipped. The schools have everything they need to follow the state law, and we're in good shape. But as far as the start practice will really vary on which part of the county. I was in Frostproof yesterday. The wet bulb globe temperature was 95. I got to Lakeland back to my office. The wet bulb globe was 86. So we're going to have different practice times for different parts of the county.
Thank you, Dan. Thank you, Beth. Oh, are you done?
Will that be the same for ROTC and cheerleading? The state law says it's only for the FHA student athletes, but it will be my recommendation that ROTC and cheerleading follow that same process as well. And I don't see any more questions. I thank you for the time to let me speak this morning, and thank you.
Thank you, Dan. And I just wanted to reiterate something that was said in the chat that I'm looking at. So for us, in terms of the health and safety protocols, what our group decided to do for the principals that are on the meeting is that we decided to make recommendations, and then school principals can implement those recommendations based on their own specific school site. Because you all know your buildings best, you know your staff best, and you know your students best. However, the two non-negotiables were the pre-screening in the morning So everyone does have to have a temperature check, and the other non-negotiable was a face mask. So everyone does have to have a face mask. But in terms of the arrival, the dismissal, how you serve lunch, etc., we would prefer, or we are going to defer to the school-based administrators and the principals to really determine what's best for their school. However, we're making certain recommendations for those things. Okay.
Thank you, Tedra. And a couple of other
Ted.
things that just kind of got pushed up in the chat. Just wanted to honor and recognize Mr. Miller mentioned how challenging it might be for our teachers with classroom management, with some of these maintaining, keeping a mask on, social distancing. We know that's going to be a barrier. We also have our whole child group that Christy, Dr. Olson put in there, that they are working on scripted lessons to help support teachers and help our students transition back into school. Our curriculum team is also working on embedding some social and emotional learning components within the curriculum maps to allow time for that, because we know it's going to be a big transition for everyone. And in addition to, just enforcing the safety protocols, just getting back into the groove of things. So wanted to honor and recognize and definitely say we hear you on that, Mr. Miller, and we understand. And then there was a piece brought up about visitors and those visitors that might be directly supporting a program. That was the piece earlier. I believe Tedra referenced Mr. Cochran and a subcommittee have been working on that. We know we have people that are essential to supporting our programs. Our interns at the colleges and universities, we want to keep them moving forward as our future teachers. Programs such as AmeriCorps and our partnerships with United Way and Reading Pals, and a lot of our academies, advisory board members that provide just incredible knowledge to our specific academies. We're going to have to keep them engaged, and so those recommendations for them to use those pre-screening protocols that Tedra mentioned as well, there is a plan in place to recognize that. So just wanted to mention that, Mr. Hill, before we turn it over to your last slide.
All right. All right. Thank you, Ms. Townley, Ms. Porteous, Dr. Stanky, and I believe Rob Davis, and Ms. Cummings, and Mr. Talbot, along with our wonderful guest today and our entire task force. Thank you for your leadership. Thank you for your participation. Thank you again for your dedication. We've covered a lot of ground, and we've looked at so many different nuances of this dynamic that we're in with this pandemic. And because of your vantage point as a team and all the information we've seen, we have been able to look at numerous scenarios and how they would play out in the school. And I believe we're at a point now where we have a tremendous amount of information, excellent information, and we can tweak and refine and put together our plan. So again, want to thank everyone for that. And Ms. Porteous, I appreciate him, and Ms. Townley, appreciate it again. Just reiterating to the team that, we are going to provide frameworks, as you said, and guidelines and recommendations. And we know that those will be very beneficial to each school so that we can provide those things and provide consistency, but also allow for the uniqueness of our county and our district, because we are very diverse, and there's so many different schools and so many different configurations. And so providing that flexibility within those guidelines for our principals, our school-based leaders, and obviously including our school-based staff, their input, and working with their staffs to make sure that each school has the best possible plan to provide the highest level of safety for our students and staff, and for our community members that will be coming, coming to schools to interact it. From time to time, we'll have to work out those logistics as well, and we'll have a plan for that. So again, we've covered a tremendous amount of ground, and I think this team has done a remarkable job. So I want to talk about next steps very quickly, and just want to again remind everyone that on July 14th, We're going to have the work session, a board work session, and we will be presenting the plan to the board. Please don't be alarmed by my voice. I've got my mask, my Falcon mask today, and it's just allergies. So we will obviously be working with communication with our various teams, Ms. Porteous and Ms. Townley, to email our staff and make sure our entire staff, all of our staff and employees, have the most updated and accurate information, guidelines, and protocols and procedures as we move forward to opening the school year. And we will have a press release. Ms. Townley mentioned the student registration and the selection process. We will be working closely with our, certainly we'll be working closely with our regional assistant superintendents, our school-based administrators, and of all of our teams to begin the training, to train and to prepare for August, for our staff's return, for our students' return. And in terms of the safety protocols for the health and safety operations, that will be an ongoing process. And we will solidify those plans, provide those frameworks, provide those guidelines. But we will continue to, as we all know, this is very fluid, so we'll continue to work on that. We'll finalize it, but it will be what we like to call a living, breathing document, so that we can adjust and adapt and improvise when we need to. We'll be finalizing our instructional continuity plan, and we'll continue to prepare and increase our social emotional supports for students and staff. Implementing, Ms. Townley talked about Schoology. That learning management system we think is going to be outstanding for our students, also for our teachers. And so there'll be a lot of training that will have to be held there. And then we know that technology is still going to play a major role. And so we're going to continue to make sure that we expand our technological opportunities, devices, and connectivity for our students. I believe that is it for me. I think we've covered the main pieces. We will be reconvening as a team. We'll send out notification for that, but we are going to pause to get this get the plan lifted and begin working toward implementation. And then we will reconvene to assess and monitor as we develop out this plan and begin to implement it. Are there any additional questions?
So with next steps forward, this is Stephanie. With next steps forward, after we present to the school board on Tuesday, when during that week, probably after the school board meeting, will we be coming back to the table? Probably between the three unions, because a lot of this affects, or the two unions in the district bargaining team, because a lot of this affects both employee unions equally with health and safety.
Right.
So would we be coming back to the table, that week after the 14th, so that we can start negotiating these working conditions, Tedra? With
yeah,
your
I was
team?
going to say, Tedra, if you'll take that question, thank you.
Got to unmute first, but yes, yes, we will. A lot of it obviously does deal with working conditions, to be frank with you, Stephanie and Larry. And so, yes, we have to really work through first the particulars in terms of what we are thinking before we start to negotiate that and talk about that. But obviously we have to get it done before August 3rd. So I know that time is of the essence. We will send out also a not a survey, but just a quick link. It's called an intent to return. I'm going to borrow it from another district. One is for instructional, one is for non-instructional, to really see what the intent of staff is in terms of what they'd like. We have a lot of staff that have underlying health conditions. We've received emails from them in HR saying, hey, Tedra, I'm not comfortable returning to work. I really want to do Polk virtual. I'm thinking about doing Florida virtual, or are there any other options? And so we really need to get a feel of that first before we actually start doing the negotiations, because I need to know how many teachers, if I'm just looking at the teachers unit, will be there to teach. And then from there, I can really go ahead and develop the plan. I really don't anticipate, though, a lot of changes in terms of outside changes to the collective bargaining agreement. Obviously, we're going to try to honor the collective bargaining agreement as much as we can in terms of its current form. However, our whole thing since this started, I'm going to borrow this from Michelle, was grace, mercy, and flexibility, right? And that we just kind of need that to be the overwhelming umbrella that we operate under, so that so that we can get the things done. You know, and I'll publicly say this, we are not trying to do anything that would harm our teachers or any of our staff. You know, they are our most important body of individuals that we have. And as an organization, we need to make sure that we take care of them. And so, again, we're going to try to honor the contracts as much as we can. Hence why we're thinking about even providing or trying to provide extra work to the bus drivers, you know, and bus attendants to make sure that they can pay their bills. And, you know, if you think about it, y'all, we are the largest employer. So we are responsible literally for the community as a whole. And so we have to think about that. So I'm saying all that to say, yes, we'll sit down, we'll work with you, but I'm just publicly asking for grace, mercy, and flexibility so that we can do our job in educating students and keeping staff safe.
Thank you, Tedra.
Welcome.
Thank you, Stephanie.
Hey, John.
Ms. Bird, are you there?
I am here. And
all right. Thank you.
And I believe it's still morning everywhere. Good morning, everyone. I've been on and enjoyed the conversation this morning from Dr. Kalita and Dr. Alexandra. Great conversation, lots of things, some things that we didn't think about that we probably need to look into. One of the things I do want to say when asking the question about the next steps is that we also have to remember, Kedra's right with, you know, we have to sit down and look at what do we need to do for our teachers and our staff. My goal has always been to keep everybody employed throughout this whole pandemic. That is my goal. It's going to be some different ways we do work, some different things that we do, but that is the goal right now. As you know, we're entering into a budget that is going to be very, very tight. But we are looking for that. We're also looking to make sure that we protect staff. But one thing I kept hearing this morning from the doctors was, we got to protect our teachers and our staff. And that's where we should be putting our resources. And I was glad to hear that being said, because we got to make sure we do those things. So creating those forms where people are letting us know if there's underlying health conditions, that's going to be very important. If you remember in the beginning when I said when we were doing Polk Virtual, anyone with those underlying health conditions that felt like needed to move to Polk Virtual, that was going to be the first avenue I wanted to push those teachers to go to Polk Virtual. But after the 14th, I also want us to keep in mind, we have to also respond to our community and our parents. Parents will have to know, you know, of an option that they're going to select. And the sooner we get that out to our parents, then we will know how we staff our buildings. Are you going to have more parents that's going to say, no, I'm going to choose Polk Virtual, or I'm going to go e-learning? So we need to get that out right soon after we do the board presentation, so that our parents know what option they're going to choose, and then we know how to staff our building, and then we can make better decisions with our unions of how do we make sure our employee workforces, they're all employed and where they're going to go next. So I wanted to make sure I added that in. I want to thank the committee. I've been listening on several, but I want to thank the committee for the work they've done. I believe you all have dug really deep to make sure we provide the best opportunity for our students. Also keep in mind, again, uncharted territories, uncharted waters. We also have to remember, if we have to shut down, we need to make sure we have e-learning ready to go fully. So we're going to make sure we really focus on, if that comes to pass at any point in the year, are we really ready to make it go look different than it did in March? Because we do know we need to step it up. And I think I see Sarah Fortney is asking about the mandatory mask or some guidance or parents' decision. We heard that very loudly today. Mask is the one thing we're going to have to do. I think we're going to have to look at how we're going to enforce that. I do like the idea of having people go around the buildings and walking around looking. Now, can we afford that? I don't know yet. So it's going to take some different things that we're going to look at to make sure. But I do believe masks is as you know, in the district, you cannot enter a district office now without a mask. I am willing to say to this group, I am willing to take it forward and make masks mandatory in schools. If that's what the doctors are recommending, that's what's going to help us, that's what's going to protect our staff, then that's what we need to do. That's where the science lies, is with the mask. So I do want to thank everyone for their work. Also, this team will stay together throughout the year. I would like for you all to remain, because there's going to be times we're going to have to discuss what's happening, what's going, are we having to readjust? And I think it's just going to be our way of work for the next year. So thank you, everyone.
All right. Thank you, Superintendent Byrd. Ms. Byrd, we appreciate you being on today, and thank you for your leadership. Team, we've had a very outstanding, well, it's been an outstanding meeting, and lots of great dialogue, information. And so we thank you again. And if there's not anything else for the good of the group, Michelle or Ms. Porteous, we will be communicating, sending out a communication, and we'll send out a calendar notice for our next task force meeting. And again, thank you for your hard work, your dedication. Obviously, we can continue to communicate. If something comes up, we will communicate via email. But once again, thank you, and have a great day.